Question 391. To improve overall health, the nurse should place highest priority on assisting a client to make lifestyle changes for which of the following habits? A. Drinking a six-pack of beer each day. B. Eating an occasional chocolate bar. C. Exercising twice a week. D. Using relaxation exercises to deal with stress. Answer A. Explanation. Health promotion is motivated by the desire to increase people's well-being and health potential. The nurse promotes health by maximizing the client's own strengths. Identification and analysis of the client's strengths are a component of preventing illness, restoring health, and facilitating coping with disability or death. The nurse facilitates decisions about lifestyle that enhance one's quality of life and encourage acceptance of responsibility for one's own health. Health promotion and maintenance. Topic 5, question set E. Question 392. When a middle-aged woman says to the nurse, "I'm really worried about menopause. When my mom went through it, she got really depressed." The nurse's best response is A. It is a myth that women get depressed because of menopause. B. Menopause is a normal developmental process. C. It sounds like you are worried that you might become depressed during menopause. D. When women experience depression during menopause, it is usually because of social stresses. Answer C. Explanation. Choice 3 is not only acknowledges the client's fear but invites more disclosure and discussion. Reflecting listening is very therapeutic and in this case acknowledges the woman's unspoken fear that she might become depressed like a mother. When the fears have been acknowledged and she feels that the nurse understands, she will be more open to the teaching or interventions to follow. It is a myth that menopause causes depression, but to say that to the client does not acknowledge the fear she shared with the nurse and gives the impression the nurse doesn't care about her concern. It closes down communication. It is also true that menopause is a normal developmental process. This can certainly be used in teaching, but not to address her immediate concern. The client might feel the nurse doesn't think her concern is appropriate because menopause is normal. If women experience depression during menopause, it is usually due to social stresses such as loss of loved ones, loss of roles, caregiver demands, and physical problems. Choice 4 is true, but is a non-therapeutic response in this situation. Health promotion and maintenance. Question 393. A spinal change occurring with pregnancy that alters mobility is A. Scoliosis, B. Kyphosis, C. Lordosis, D. Ankylosing spondylitis. Answer C. Explanation. The spinal change occurring with pregnancy is lordosis. This occurs due to the weight of the enlarging uterus and the effect of gravity. Basic hand comfort. Question 394. Mrs. Owens is the 81-year-old mother of Jonathan, who is 54 years old. Jonathan has had schizophrenia since he was 16 years old. Which of Mrs. Owens' concerns is likely to predominate? A. Will my retirement funds outlast me? B. Who will handle my funeral arrangements? C. What will become of Jonathan when I'm gone? D. How can I get Jonathan's physician to talk to me? Answer C. Explanation. The mother's most prominent concern is likely to be what becomes of her son after she dies. Choice 1 is important because it's not likely to be her most prominent concern. Choice 2 is also not likely to be a primary concern because the welfare of a son with schizophrenia is more important. Choice 4 is incorrect because Mrs. Owens has likely confronted and handled concerned about getting the physician to talk to her after 38 years of managing a son's care. Psychosocial integrity. Question 395. Which of the following is not a primary function of the kidneys? A. Blood pressure control. B. Vitamin D activation. C. Erythropoietin production. D. Reabsorbing waste products. Answer D. Explanation. All of the choices are functions of the kidneys except reabsorbing waste products. The kidneys excrete waste products. Physiological adaptation. Question 396. Which control group has the highest instance of inflammatory bowel disease, IBD? A. Asians. B. Caucasians. C. Hispanics. D. African Americans. Answer B. Explanation. Caucasians have the highest instance of inflammatory bowel disease, IBD, reduction of risk potential. Question 397. Which of the following statements indicates adequate dietary understanding in a client with constipation? A. I should decrease my intake of fluids. B. I should decrease my level of activity. C. I should increase my intake of apples. D. I should increase my intake of milk. Answer C. Explanation. Apples are a source of high fiber, which decreases constipation. A constipated client needs to increase fluids and activity level. Milk is not a high fiber food. Reduction of risk potential. Question 398. Which of the following should be included in a diet rich in iron? A. Peaches, eggs, beef. B. Cereals, kale, cheese. C. Red beans, enriched breads, squash. D. Legumes, green beans, eggs. Answer A. Explanation. Home sources of iron that can be absorbed in the body includes meat, poultry, and fish. In addition, these sources contain a factor that helps to enhance iron absorption of non-heme sources. Eating vitamin C at the same time as iron sources also helps to promote iron absorption. High calcium intake in the diet promotes the absorption of iron because it helps to bind the phytates and thereby limits the effect. Physiological adaptation. Question 399. The nurse should consider which of the following as a possible cause for the symptoms experienced by the client in question 28. A. Iron deficiency. B. Folate deficiency. C. Peptic user. D. Iron overload. Answer A. Explanation. Due to a symptoms of fatigue, shortness of breath, lightheadedness, agenda, and a fat dieting, the cause is most likely iron deficiency. Physiological adaptation. Question 400. The nurse should make which of the following responses when questioned by a client about the role of leptin in the body? A. It increases food intake in clients, thereby promoting obesity. B. It assists in the regulation of steroids. C. It increases the total fat mass of people who are obese. D. It might decrease the total fat mass in the bodies of people who are obese. Answer D. Explanation. Leptin is expressed in fat cell coding for the protein that reacts to the percentage of fat cells in the body. Leptin is associated with increased energy expenditure and decreased food intake via hypothalamic control. Obese clients might have insensitivity or resistance to the effects of leptin. Leptin can affect other body hormones such as insulin. Genetic factors include leptin uncoupling proteins and the amount of brown or white fat in the body. Physiological adaptation. Thank you for watching.